childhood obesity, local actions to address the national threat. Eduardo got his bachelor's degree in chemistry, I believe, in biomedical engineering, and as a physician in medical school training in MPH as well from the University of Texas. He was Commissioner of Health for Texas for about a half a dozen years in the 2000s, and is currently the Vice President and Chief Medical Officer for Blue Cross Blue Shield of Texas. Eduardo has served on some very prestigious committees and panels. He's currently the chair of the advisory committee to the director of CDC, and he's on the standing committee of childhood obesity from the National Academy of Sciences Institute of Medicine, or IOM. And he's also been on a number of those IOM panels. I know him because we worked together on this local government actions panel. He was the chair of that panel. And so I'm very happy, and we're all very fortunate to have him here today to talk to us about his work. Thank you.
Thank you. How are y'all? It's a real honor and pleasure to be here. I did have the privilege of working with Diego over the course of many months as we tried to develop this local government actions report. I will hold it up in a moment. I don't know if y'all have seen IOM reports in the past. They're generally big and thick, and the font is really small, and you need a dictionary to read them, and this thing is really designed to be very user-friendly for local elected officials, for folks who are interested at the local level and trying to figure out what are some things that could be done. And I know that here in New Orleans there's some of those things being done to address childhood obesity. A couple of things about me. I do have an MPH. I went to school at the University of Texas School of Public Health. I served as the local health officer in Austin Travis County for 4 years. I did serve as the state health officer from 2001 to 2006. I was the health officer when in over Labor Day weekend 2005, 250,000 of your fellow Louisianans decided they wanted to come visit Texas because the weather was really bad here. And that was a very, not only an interesting experience from the perspective of leadership in public health, but truly it was it could be what was the most important 40-day period of my public health career. It was a big deal to try to figure out what to do and how to do a welcome for 250,000 Louisianans. And if you remember, about 3 weeks later, there was another lady who came to visit, Rita, and Rita was big enough that people from all over the Texas Gulf Coast left the Gulf region. About 1 million Texans went into the interior part of our state, and what was already kind of a challenging situation became a little bit more challenging. I'm going to be talking about something completely different, and I think the great thing about that is, again, the reminder that that public health degree that maybe a whole bunch of y'all are seeking is one that has a wide variety of uses, whether it's preparedness, whether it's communicable disease, whether it's non-communicable disease, or things like childhood obesity. And a step beyond that is I am trying to bring a population health perspective to what happens in a health plan. And you would think that that's already there. And I would say to you, some health plans are there, but many health plans are still very much focused on how to do the medical care delivery system stuff, not so much how to keep people healthy. I do have an interest in childhood obesity. I will try to make the case that childhood obesity is indeed a serious threat to the health of America. For some audiences, I talk about the economic competitiveness threat that it is, and to some audiences, I talk about the national security threat that childhood obesity is. Before I go any further, the person that makes my life worth living every day is my wife, Catherine, and here she is. She doesn't often come with me anywhere, and this is a very special weekend for us to be able to get away without our kids and know that they're being taken care of by their grandmother. We do have a mission statement at Blue Cross Blue Shield of Texas to improve the health of members, that is people at Blue Cross Blue Shield of Texas Insurance, and communities, and that's really important. I'm going to talk a little bit about that through accessible, cost-effective, quality health care. 3 challenges, and I'd say there's actually 4 challenges in our nation to achieving what we spent 2 years talking about and calling healthcare reform. I'd like to think that healthcare reform really was all about a means to an end, because ensuring more Americans, well, probably everyone in this room would agree that's probably an important thing to do. I hope everyone in this room understands that just giving everyone an insurance card doesn't suddenly make us all healthy. The health part may not even be mostly done through the clinical setting with that health insurance card, and there's at least 3 phenomena, and I'll bring up a 4th because November 2nd reminded me of the 4th. 3 challenges to achieving optimal health status in our country. We have an aging population. What's that have to do with childhood obesity? As the population ages and we keep putting more and more resources into keeping our seniors, mothers-in-law, my parents, y'all's grandparents and parents doing well, that the cost associated with that is substantially higher than the cost associated with people under age 65. If indeed it's a fixed zero-sum game, then more resources going there mean less resources going to other places. We have some shifting race ethnicity demographics. I know y'all have studied demographics or will, and in the state of Texas, I talk about the state of Texas because it is a harbinger of things to come. Right now, 33%, actually I think it's 37% of the population is Latino Hispanic. By the year 2030, 2035 or so, 50% of the population will be Latino Hispanic. Why does that matter? Well, it matters if there are differences in the prevalence or the distribution of disease, and I'll talk a little bit about childhood obesity, but there's other things around which, or for which, Latinos and African Americans particularly have a higher prevalence. If the population is shifting to be more of that than of something else, then we will have a burden of disease that maybe we need to think about. Doesn't mean it's a bad thing, it just means it's a thing that's coming. And then the last one is obesity, and I'll talk a little bit about that, and I've got some slides. Here's my picture of that. And for those of you who don't know, this is Cerberus, the 3-headed dog that guards the gates of Hades. And our daughter Isabella is a Greek geek. She knows all about Greek mythology, and as we were driving in the car, and a few months ago, I was trying to think of some 3-headed beast. She said, well, Dad, don't you know who Cerberus is? And I lied and said yes. There's Cerberus. Now, this will be, I think, the only time I use the F word in this conversation. The United States is the fattest country in the world. That's the F word I'm talking about. And just look at these numbers. Mexico, Chile are 2nd and 3rd. New Zealand and the UK are 4th and 5th. And I guess if nothing else, there is clearly a preponderance in the Western Hemisphere, but Europe is not immune, or part of Europe, close to Europe is not immune, and the Southern Hemisphere is not immune. With obesity comes type 2 diabetes. And what this slide is showing you is that the prevalence of diabetes has been on the rise, but also the incidence of diabetes has been on the rise. Of course, the prevalence would go up unless we were seeing an equal number of people dying who have diabetes. They don't die, they live with diabetes, but the incidence is going up as well. So year after year after year, we're diagnosing more people. Now you could say, and you would be saying appropriately, well, the population is increasing as well. These numbers are increasing at a faster rate than population increase. And that bodes poorly for America. This was a front page USA Today article just last month. Diabetes cases may double by the year 2050. Perhaps triple. And here's the critical quote: prevention where it's feasible, and critical and early intervention for those already diagnosed. I want to focus on the prevention part. Diabetes, let me just sort of explain why I think we should do that. Diabetes, once you have it, is about a $10,000 plus a year proposition to manage. We do a really good job with it in America, but it's not inexpensive. Not having diabetes is more on the order of $1,000 a year. So when you manage diabetes really well, you can reduce that cost. And I'm using round numbers. If you look these up, you're not going to find it this way, but round numbers work. 10,000, you could reduce it to 9,000. So doing good management costs $1,000 a year. Preventing diabetes is only costs about $1,000 a year to provide care. It seems to me we should be trying to keep as many people as possible from having diabetes as we can. So I talked about national security, and I put this up because I think it's a really important way to frame the issue for some audiences. There are some folks, when you talk about childhood obesity to them, they're not necessarily going to be at the same place that you might be from a health perspective. But when you say to them, Mission Readiness, which is an organization of retired military, did a report that now is called Too Fat to Fight. It was called this until earlier this summer, and then they changed the name. Oh, I used the F word again, I apologize. The biggest reason why young Americans can't join the military, 27% of them weigh too much. 27% of them weigh too much. So that's a way. And oh, by the way, to continue, those same young people are people who want to be firefighters, and they want to be work in the sheriff's office, and they might want to be members of the police force, and they weigh too much to serve. Those are the same young people who want to go to work. And when they go to work, what we know is that those young people that are overweight and obese now will only, that cohort will only grow in number and in size, and their health status is not the same as the health status of folks who are healthy weight. They will develop some things, and I'm going to have a slide in a minute that talks about that. The prevalence of childhood obesity is on the rise, and that's really important because the other thing for some audiences is that when you talk about adult obesity, which I'm not really focusing too much on, but let me just tell you, because I don't think I put a slide on there, 10 states in the United States of America, and Louisiana is one of them, Texas is not, but really getting close, 10 states in the United States of America have an adult obesity prevalence rate over 30%. In 10 states in the United States, 30% or more of the adult population is obese. Obese. They carry way more weight than is healthy. Let me back up a second and say I'm using that word and it sounds like I'm being judgmental. I'm not. It's no different than talking about 30% of people who maybe get the measles. It is it's a frightening reality around which we've got to put our arms and begin thinking what we're going to do about. So this is not meant to be and this is a group where most of y'all are healthy weight. I talk to lots of audiences where they reflect the general population. And I have to be clear to say, this is not about any individual I'm talking to or about. This is about a society.